Hey guys, in today's video, I'm sharing tips on how to prevent and treat post-inflammatory hyperpigmentation. Hyperpigmentation is the most common skin condition we face as Black and brown women, and it must be properly cared for to prevent skin damage. If you are new here, welcome. I'm Sheena, a healthcare patient advocate, and this channel is all things skin health, healthcare, and wellness for us Black and brown women. Be sure to subscribe to the channel to know when a new video goes live. Post-inflammatory hyperpigmentation, also known as P.I.H, is the darkening of the skin that arises after our skin is injured or irritated. And it occurs in all skin types, but is particularly more severe and more common in light brown to darker skin tones, as this is a result of the presence of more melanin, which is a pigment that is responsible for our skin color or skin tone. So the more you have, the more likely you are to experience post-inflammatory hyperpigmentation. Post-inflammatory hyperpigmentation can happen as a result of any skin trauma, and it's your body's way of trying to heal itself, really. So when you see inflammation with swelling and or redness, the skin cells are now inflamed and they are now triggering melanin to be overproduced in the cells. When there's more melanin produced, it is deposited around the area of trauma, leaving brown, light brown, medium tan, or dark discoloration marks on our skin. The number one cause of P.I.H is acne, and this is understandably so, as you can imagine, because acne is the most common skin disease. Other causes are insect bites, having the wrong skincare practices, the incorrect use of cosmetic procedures, post-surgery trauma, burns, cuts, allergic reactions, and chronic inflammatory skin diseases such as psoriasis and eczema. It's very important to be diagnosed by someone who's experienced in treating skin of color and who can give you a proper diagnosis. Otherwise, you might be barking up the wrong tree, causing lasting damage and wasting hundreds of dollars on products and treatments that are never going to work because you didn't have the right diagnosis to begin with. The intensity of the inflammation or acne can determine the depth of your hyperpigmentation, the color, and how long it sticks around. It's always best to try to treat the underlying cause first. Many patients and clients will visit a dermatologist or an esthetician expressing their stress and frustration dealing with their ongoing hyperpigmentation. And when these skin professionals look more closely, there's actually active acne present. So again, the most important thing to do in the very beginning is to treat the underlying cause and then address your hyperpigmentation. The prevention of post-inflammatory hyperpigmentation starts with preventing the causes, as you can imagine. As a base, you want to have a skincare routine that is tailor-made for oily skin or sensitive skin. First, you want to avoid skincare mistakes such as popping pimples, because when you pop your pimples, you drive the inflammation deeper and you get more hyperpigmentation that will actually take longer to clear, and you'll increase the likelihood that you may develop pitted acne scars. So the second which is the mainstay in the prevention of post-inflammatory hyperpigmentation, is the use of sunscreen. Yes, we all need sunscreen, and you want to use a broad spectrum sunscreen that protects you from UVA and UVB rays without leaving a white overcast and a oiliness. You need to wear sunscreen daily, whether the day is cloudy or whether the day is sunny. And you also need to remember to wear sunscreen indoors. Next, it is important to use gentle skincare products that are not drying, so you do not cause any irritation. Also, using harsh ingredients will alter your skin barrier and trigger inflammation. You also do not want to use harsh physical exfoliants, as they cause micro tears, which trigger the inflammation we're trying to stay away from, and they'll also trigger rebound hyperpigmentation. Another way you can prevent post-inflammatory hyperpigmentation is to calm the inflammation that arises from an insect bite or another inflammatory skin condition. For example, with low-dose prescription creams, however, dermatologists recommend using them in limited amounts and for a very short period of time. And you should really use these on the direction of a dermatologist. After you treated the primary issue or the cause, and you have a sunscreen that does not cause the dreaded white shadow overcast and the extra oiliness, active ingredients such as vitamin B3, vitamin C, and vitamin A in the form of retinoids and retinols can be very, very helpful. Vitamin A is a very popular treatment for treating P.I.H. If you are going to use vitamin A in your skincare regimen, it's really important to start using it just a few times a week. Trust me, and apply it at night, and then gradually increase the frequency of use. Vitamin C is often used with vitamin A for an effective treatment regimen. If you do add vitamin C into your routine, use it in the morning before you apply your moisturizer and your sunscreen. Acids also work very well for skin of color. It's better to exfoliate with the milder acids like a lactic acid, for example, as they are going to exfoliate your skin without causing much of the inflammation, again, that we're trying to avoid. Use them at least once a week, but no more than 3 times a week. Next is general exfoliation, the removal of dead skin cells. Now, this is a natural process, but as we age, the ability of our body to slosh off all of these dead skin cells decreases. So you want to assist your body in doing this by exfoliating using chemical exfoliants rather than the physical exfoliants we talked about before, because these physical exfoliants have been shown to cause micro tears in the skin. And of course, you can also incorporate in-clinic treatments. One option is a chemical peel to improve skin texture, to treat hyperpigmentation, and even treat acne. But if it's done incorrectly, it will do more harm than good. With chemical peels, they should not go too deep to prevent any skin damage. There are 3 types of chemical peels. There's a superficial peel, the medium peel, and deep peels. Another in-clinical treatment is a laser resurfacing treatment, where light is used to target areas of your hyperpigmentation. Just like a chemical peel, you have to do a laser peel with caution to prevent rebound hyperpigmentation and some lasting damage. This procedure is very effective when done correctly, and it's usually reserved for severe acne and severe hyperpigmentation. The third treatment option is microdermabrasion, which is now my personal regular go-to maintenance treatment after trying chemical peels. During a microdermabrasion treatment session, an esthetician, more than likely, or even a dermatologist, will use a drill-like handheld tool with a wire brush or another abrasive attachment. The tool is then swiped across your face rapidly but gently to remove the impacted epidermis. This works best for superficial hyperpigmentation. So those are the top tips for understanding and fading your hyperpigmentation or PIH. I hope that this video helped you. If so, please give it a thumbs up, subscribe to the channel if you weren't already, and be sure to share this video with your friends. For help finding a dermatologist or an esthetician near you who's skilled in skin of color, text me at the number below and I'll get you the information you need. Until next time, be well.